The government is on the defense tonight over accusations of neglecting its frontline workers following the death of one more doctor who succumbed to the effects of COVID-19. Chief Administrative Secretary in the Ministry of Health, Dr. Mwangangi, saying the government had already met some of the demands of the doctors who have threatened to down their tools come December 21st. And as Chemutai Goin reports, the doctors today demanded that the Ministry of Health foots all the bills of doctors who have contracted or succumbed to COVID-19 and that their families be compensated. Chemutai Goin tells us more.
A somber mood at the home of 28-year-old Dr. Stephen Mogosu in Iranda Village, Kisii County. A family in mourning after he succumbed to the effects of COVID-19 Monday, leaving behind a widow and a 5-month-old baby.
Sisters wake walipombereka na mke wake wakaambiwa mtoe 200,000 hiyo tuandike ndio muingie. Wakasema we are not able, wacha tuendelee na mgonjwa pale.
Dr. Mogosu died at the Kenyatta University Teaching and Referral Hospital. His body now preserved at the facility's morgue, awaiting the payment of his hospital bill, running into millions of shillings. And as the Doctors Union KMPDU held a minute of silence for their fallen counterpart, they demanded that the government considers the plight of the families of over 10 doctors who had paid the ultimate price, even as they threatened to make good their threat to strike.
My colleague, my friend, my senior, Dr. Rogito Mogusu, could not afford the services that he was offering to the general public.
We as KMPDU demand that the Ministry of Health take full responsibility for all outstanding medical bills and compensation to the family.
Amid the doctors' demands were shocking revelations that some of the infected doctors had been forced to continue working owing to the shortage of medical personnel despite testing positive for COVID-19.
Even when you go on quarantine or you get infected, you stay away from work. But because there is a shortage, and that is why we are asking for employment of more doctors, our doctors are being asked to continue working if you are not exhibiting symptoms. That is how bad the situation is.
But the government, through the Ministry of Health, is maintaining that it has met some of the demands by the doctors, calling for their patience.
If there is an issue that can be dealt with now, I want to give you the highest assurances. It has already been dealt with. And so whatever is pending are issues that require engagement with different stakeholders. Government is duty-bound, and it acknowledges it is duty-bound to take care of our healthcare workers.
And with the Health Cabinet Secretary Chemutai Goin coming under pressure for telling Kenyans that he had authorized KEMSA to release the much-needed personal protective equipment needed by the health workers, yet this had not been done. Mwangangi revealed that a memo authorizing the sale and release of the PPEs had been forwarded to the Cabinet for approval.
We've had discussions with the KEMSA management to be able to come up with a modus operandi of how these PPEs will be able to get to the counties.
On Wednesday, various stakeholders key in forestalling the looming crisis in the health sector will appear before the Senate Health Committee. Amid heightened criticism over their threat to down their tools at a time when the country is battling the COVID-19 pandemic, doctors say this time they are fighting for their lives. And unless the government heeds to their needs, then Kenyans will be on their own. Chemutai Goin, Citizen TV, Nairobi.